Adaptic Health is revolutionizing patient recruitment into clinical trials through community engagement. Over 20 million critically ill patients and their doctors face medical uncertainty, not understanding the effectiveness of the treatments they're on. These patients, they're feeling overwhelmed with the finances, the relationships that are being under struggle as they face this medical uncertainty. Clinical researchers, they're there to be able to help take care of a lot of those uncertainties and to collect the evidence that's going to understand which treatments work best for whom. But less than 5% of patients actually are a part of clinical studies. That means that 95% of healthcare activity we're not getting insights from. Patient recruitment is hard. There are so many people that don't know about clinical studies. There's historical mistrust. There's also social factors like financial struggle that make it really hard to participate in studies. Overall, this means that less than 80% of studies go over time and over budget because of the hard opportunity to be able to get enrolled into a clinical study. This challenge is so big that researchers, they'll spend over $20,000 just for a recruitment company to be able to get a patient enrolled into a cancer trial. These patients, they are under such great, tremendous stress. And we realize that even that $20,000 that a recruitment firm is getting is also a challenge because even the dropout rates are so high. It's 3 times the cost to try to replace someone in a dropout. Over 4,000 trials are open today trying to recruit 1 million patients into those studies. So we see that patients, they're seeking options to be able to get treatments, but they don't know they exist. Researchers, they need patients, but they can't reach them. Obviously, there's been many people that have tried to solve this matching problem. And oftentimes they face it from a technical solution. And there's AI that's helping you to match and identify patients and the clinical studies. And even, in fact, some of those opportunities, that experience our team has. One of my co-founders and I, we actually built out a platform a few years ago that was used to help accelerate the COVID vaccine trials at a previous company, and that company exited for $400 million. But there is also a non-technical problem, a problem of acquisition, a problem that algorithms can't solve. And my wife and I, we've seen this up close as we've been pastors for the last 7 years. We've seen the struggle that it is, the toll that families go through emotionally, financially, relationally, because they are in this health crisis. We have seen what it takes to be able to help these families go through this struggle, and I've had to look for better ways to help guide them, try to give them hope as they're going through these health crises. So Adaptic Health, we're trying to address those social factors, the non-technical things that are preventing people from getting into clinical studies. And the great news is that the church, the community engagement, can be the solution for that. So the church might seem like an odd partner in all of this. So how can we have a win-win with patients, the community, and with researchers? Well, it shouldn't be a hard problem to understand. It should not be such a surprise that the church could be the solution for a part of this. Because the church is already a trusted institution. The church is already getting many patients, many people coming in, asking for prayer, asking for a hospital visit. And even pharma companies, they're sponsoring conferences and trying to educate health leaders because they realize that the church can be an ally in public health. Adaptic Health, we're offering a free service that we're calling Caring Hand that gives opportunities for patients to be able to get access to their medical records, to be able to get second opinions, to be able to get matched into clinical studies. That data, we're able to also help them fill out all the paperwork, be a concierge service for them as they go through this journey. Help them stay connected to family as they are able to get drafted messages to keep them updated throughout the years that journey might take. These AI-powered services are something that are addressing immediate needs securely and efficiently. And it's all empowered based upon the HIPAA rights that they have to be able to access and share their information, their health records, for their benefit. We're also offering a training and resourcing for church leaders and their care teams to be able to better navigate patients throughout this journey, both practically and spiritually. And this is all part of the Caring Hand service. Our model is creating a virtuous cycle that allows patients to be able to get the care that they need, get matched into studies, and we're able to provide value to the patients and the researchers. And the researchers will pay us $20,000 to be able to facilitate this service. And as we are seeing with the overall margins, we're able to have an 80% gross margin, be able to provide this service for the patients and the community. In just 6 months, at 2 of our locations, about 1,500 people, we've been able to see some great health outcomes. 3 people enrolled into studies, higher adherence rates, being able to have anxiety levels as they go into the hospital visits actually be lower, scoring normal, which is unheard of. I really believe that this doesn't need to be just a one-time thing. What if this model, what if this could scale? What would this mean for patients and for research breakthroughs? We're on a mission to revolutionize patient recruitment into clinical studies through community engagement. Join us in this movement. Help us connect to church leaders who have care ministries, to cancer researchers who are leading the frontier, and to cancer patients who need a caring hand in this journey. Thank you.